Like this.
At a glance, it would appear this first trip to the dentist isn't going well, but looks can be deceiving.
That's okay, because if they cry, their mouth is open and the dentist can examine them. So we're cool with them crying, and we always tell the parents, you don't have to hush them. It's okay if they cry. I'm just checking in with Dr. Chang and see.
Carol Allen isn't a doctor, but she is an expert. The coordinator of the Access to Baby and Child Dentistry program, commonly referred to as ABCD.
I know you want the pink one.
It ensures coverage for every child in Seattle and King County at the earliest age possible.
My job is to help families find a dental home. That's really, really my job.
Hi.
ABCD brought 2-year-old Simone to Green Lake Kids Dentistry,
There it is. That's my tooth counter. Do you have a tooth counter too?
where Dr. Troy Hull specializes in kids.
Well, we wanted to create a place where people want to come and are happy to come to, rather than a place where they feel like they have to come.
It all begins in the waiting room.
This is a pretty cool office, huh?
Any child would be hard-pressed not to have fun here. From interactive games to age-appropriate movies, it feels more like a child care center than a medical office. A far cry from what Simone's aunt experienced as a little girl.
And I remember being a child and hating the dentist. It was the worst experience. It wasn't kid-friendly at all.
So are you two? You are. You are such a big girl.
From the outset, Simone's visit feels comfortable. Dr. Hull believes it sets the tone for a lifetime of positive dental experiences.
I used to be an adult dentist, and 95% of the adults that came to me that were afraid of the dentist said it was something that happened when they were a kid. And so through my experience, I've found that the earlier we start seeing children for dental appointments, the easier it is for them and the less chance they have of developing that long-term fear.
The recommended age for a child's first visit is 1 year old, or 6 months after the first tooth grows in. But for many families, early intervention is cost prohibitive. That's where Carol comes in.
If a parent called today and needed a dental appointment, I can get them in tomorrow with a provider, and it's a free visit.
Who's this? This is Wendy.
She connects qualifying families with participating dentists. The public-private partnership gives providers special training to work with children. The appointments are covered by Medicaid, and kids like Simone get the care they need at the age they need it.
Today, Simone, I'm gonna brush your teeth for you. So we're going to use your new toothbrush. I'm gonna stick some toothpaste on it, and all you're gonna have to do is go, ah, really big.
Because ABCD providers are trained for tricky situations,
Ready, Simone? Ready? Brush, 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 go.
they know how to adapt to their young patients' needs. Crying is normal, and it passes quickly.
Brush, 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 brush.
1, 2, 3. You did it! Way to go. You did so good.
After one cleaning, the experience isn't frightening anymore, and the child's overall health is enhanced.
Probably the most important thing with children is behavior. If children have an unhealthy mouth, they typically have difficult behavior issues, largely in part from the inability to eat, the inability to sleep. It's very important to our overall health to keep our mouth healthy. Our mouth is kind of the window to the rest of our body, and if it's not healthy, then the rest of the body isn't healthy.
She did fantastic for her.
There are 115 ABCD providers throughout King County. From 2003 to 2006, 12,600 kids went through the program.
I'm just so happy to be doing what I do. I love my job. I do. I really love my job.
So does Dr. Hull.
Oh my gosh, look at all those beautiful teeth in there. 6, 7, 8, 9. Oh, good job. Oh my gosh, you are so good at all of this stuff. I'll show you. Look, look.
Like clean your teeth?
It's a little baby paintbrush. You're done. You did it. Great job. I am so impressed. Here, high five. Nice job. I'm proud of you.
On this day, he gives Simone a clean bill of health.
Do you have any questions?
No.
Okay. Well, I like to see him every 6 months for checkup.
For her aunt, it's peace of mind at a cost she can afford.
I thought it was phenomenal. I really liked it. It was very, very, very kid-friendly. So the fact that this is kid-friendly and that anyone can come and it's covered, that's a huge plus. It's a huge plus. Say cheese.
The appointment ends with Simone taking her official place on the wall as a new patient. The kind of patient Dr. Hull and the ABCD program are committed to serve.
I think healthcare is something that everybody deserves, regardless of their circumstance at the time.
Say bye. Tell everyone bye-bye.
Bye-bye. Thank you.